Hi there, Dr. Hizon here to talk about documenting for the patient with high blood pressure, otherwise known as hypertension. As a disclaimer, please refer to your particular doctor. This is a general course, not intended to be medical treatment, and your situation might vary. So the symptoms of hypertension, frankly, there might not be any. That's one of the challenges, is hypertension is a silent killer. But there could be severe headache, fatigue, confusion, vision problems, pounding in the chest, as well as a history of elevated blood pressure. You want to get the blood pressure taken in 2 or more different ways. Take it for different parts of the body. You might have it standing, sitting, or supine. You might also do other measurements such as the weight, height, and waist. You'll look at the retina or the eye, heart exam, abdominal exam, and then exam of the neck, thyroid, and neck veins. So the history and physical is important, lab tests, as well as an EKG. On the treatment, it might be lifestyle medication changes, such as reduced alcohol use, hypertensive medications, and regular visits to the provider. Besides the other lifestyle medicines, they might want to adjust the sodium intake, as well as quit smoking. There might be different medications, such as diuretics, beta blockers, ACE inhibitors, which is the type of blood pressure medications, which is angiotensin converting enzyme inhibitors. There may be different kinds of these, like a type 2, calcium channel blockers, and you want to have them monitored on a regular basis, possibly every month or even every 3 to 4 months. Usually it's going to be adjusting different things in their environment. We'd like them to obtain their ideal body weight. We'll use medications and follow up with their primary care physician. So in terms of documenting the patient with hypertension, a typical chief complaint might be elevated blood pressure of so-and-so time for a patient with a history of hypertension. Ms. Jones is a 62-year-old female, history of diabetes, with a history of elevated blood pressure, presents today for elevated blood pressure for 14 days. And we will go through the rest of the template in terms of filling out the exact questions and answers. You want to look, is there any chest pain? Because we're really worried about, are they, with this high blood pressure, at an increased risk for heart attacks or strokes, and are they having it at this time? So we'll look at pain level out of 10, where 10 is the worst pain they've had. Are they having these other symptoms, difficulty breathing, irregular heart pounding, pounding the chest, neck, or ears? And then we'll look, is the elevated blood pressure constant or intermittent? Do they have any pain associated with it? If so, describe the pain. And then provocation. What makes their blood pressure better? What makes their blood pressure worse? Do they have any other associated symptoms, like is their blood pressure getting too low at night? Do they have tingling? Do they have pounding in their chest or chest pain? Confusion? Do they have a previous history of elevated blood pressure? How often do they check it? What other treatments have they had? What other workups? Have they had a physical exam, labs, daily blood pressure checks? And have they seen specialists such as a cardiologist or pulmonologist? And then, are they a tobacco user? How about drugs? Do they use any supplements? How's their exercise, nutrition, sleep program? Have they gained or lost any weight? That's constitutional symptoms. And then how is their rest of their body? And you go through the whole review of systems. On the objective template, you give a general statement at the beginning, and then you'll go through usually the neck. Do they have range of motion that is normal? How is their, do they have tenderness to palpation? Do they have any elevated jugular venous distension? Look at their cardiac, pulmonary, and abdominal exam. And in the medical decision making, you want to decide, is it simple or complicated? Does it require straightforward or complex decision making? And this is when the provider will give the rationale and the reasons for why they treat in a certain way. In terms of ICD-10 codes, you can use any number. Z code is a screening code for examination of the blood pressure. So that'd be a Z01.30, an encounter of the examination of the blood pressure without an abnormal finding. The 31 would be with abnormal finding. It could just be a R code, which is a symptom code, elevated blood pressure reading without a diagnosis of hypertension. And then if they truly have a diagnosis of hypertension, it would be an I-10, which we sort of joke because the interstate here in California, one of the toughest ones with a lot of traffic is the 10 freeway, and it's called the I-10, and that will give you high blood pressure. If you're from California, you might find that funny. So you look at a home exercise program for plan and treatment. We might use meds and follow up on a regular basis. Pearls and pitfalls: be sure to get the correct side if there is any laterality that they talk about on the physical exam. Document all previous treatments and medications and family history. Learn some of the questions that are asked. Please ask your doctor if you have any questions about documenting for the evaluation of the patient with hypertension. And if in primary care, be sure to ask about quality measures that are preventative type measures. So takeaway point is that hypertension is very common. If caught early, lifestyle modification can be effective in the treatment. You usually want to see if there's been previous recorded elevated blood pressure readings, and I would study hard to learn the various questions that are going to be asked on how to do an EKG test and how to check hypertension to assist the provider in documenting. So in summary, we want to thank you again for all you do. While doctors help and save patients, you medical informatics specialists and scribes save doctors. Thank you.